Frankincense as a remedy, adverse effects and use. Compact frankincense, significant facts. Over 1,000 years ago in traditional Ayurvedic medicine and in naturopathy, the curing potential of frankincense, Boswellia, has been of immense importance in tradition. The resin of the frankincense tree contains boswellic acid. It has analgesic, anti-inhibitory, and antibacterial properties. As a result, in folk medicine, frankincense can aid with arthritis and rheumatism, as well as lessen the symptoms of Crohn's disease. Stomach discomfort is one of the most uncommon side effects. Despite the fact that frankincense has not been researched by Commission E, Scientific Expert Commission for Herbal Medicines, it is regarded as a serious medicinal plant in traditional Indian medicine and contemporary research. In Germany, frankincense dry extract is sold as a dietary supplement, but it is also available in international pharmacies as a herbal medicine. The active component frankincense is even used in beauty treatments to treat inflammatory skin conditions. Tradition and modernity in frankincense. As stated in the introduction, frankincense was the most significant remedy in Indian medicine, but it was also used in Egyptian, Arabic, Greco-Roman, and Chinese medicine. Medicinal plants such as frankincense were utilized in particular for inflammatory diseases of various types and infections. Frankincense is increasingly used to treat internal ailments such as rheumatism, lung and urinary tract diseases, and intestinal inflammation such as ulcerative colitis and Crohn's disease. Currently, frankincense is being investigated in glioblastoma, a type of aggressive brain tumor. It is also expectorant, analgesic, antiseptic, and sedative. Furthermore, frankincense can be used as an external rub for inflammation and pain. Although Commission E has not investigated frankincense, certain studies have demonstrated that it has a beneficial effect on inflammatory disorders. In a study, laboratory experiments were able to demonstrate the anti-inflammatory impact. A total of 50 studies were conducted on persons, the majority of whom were from India. The health benefits of frankincense. Frankincense for joint fire, arthritis and rheumatism. Some may already be aware of it. Joint inflammation can be excruciatingly painful. Pain from arthritis and rheumatism, for example, frequently impairs mobility. In this case, a concentrated extract of frankincense resin can help solve the problem. The effect is backed up by long Indian and European traditions that validate it. Furthermore, there are numerous clinical trials that demonstrate the effect, although there has yet to be a uniform favorable result. In India, research on frankincense continues to focus on producing and offering superior products, among other things. The focus of the research is on boswellic acid, which is enriched correspondingly in the new goods. Frankincense reduces inflammation. Inflammations, which are red, swollen, hot, and painful, can also have a negative impact on one's quality of life. In such cases, the dry extract of frankincense gum resin can suppress a hyperactive immune system. Furthermore, the essential oil's constituents minimize edema. Furthermore, frankincense can help to reduce the negative effects of inflammation, such as tissue damage by enzymes and oxidative stress. Analgesic properties of gum resin compounds have been demonstrated in animal experiments. Traditional Chinese medicine recognizes this truth as well. As a result, some diseases can be linked to uncontrolled inflammatory states. Under controlled conditions, frankincense appears to help with osteoarthritis, rheumatism, asthma, and Crohn's disease. So, while it is relatively easy to alleviate the symptoms, a cure for many major diseases appears to be almost unachievable. Furthermore, the tolerability of the frankincense product speaks for itself. Frankincense is beneficial for irritated intestines. In addition to intestinal cramps and diarrhea, inflammation in the intestines reduces our quality of life and prevents us from eating a nutritious diet. At this stage, conventional medicine is still unable to provide an acceptable answer, prompting patients to seek relief through complementary medicine. As a result, frankincense could be a possibility here. There have been some positive results using frankincense in ulcerative colitis. It was discovered that a formulation containing Boswellia serrata extract resulted in the elimination of symptoms in 82% of chronic colitis patients. This should be taken 3 times a day in the dosage of 350 mg. The medication was as successful as the usual drug sulfasalazine, which is given 1 gram 3 times a day and helps 75% of patients. In conventional medicine, mesalazine is used to treat Crohn's disease. H15 Indian frankincense extract showed to be an equal treatment in this case. However, it should be noted that more comprehensive and larger research on the subject of inflammatory bowel illness would be preferable. Arthrosis is a painful condition in which the nerves are exposed. Worn cartilage causes nerves to be released, producing inflammation and exacerbating discomfort. Frankincense extract alleviates discomfort associated with degenerative joint illnesses such as osteoarthritis, as well as cartilage loss and movement limitations. Sufferers took a Boswellia serrata extract in one of the initial investigations. The boswellic acid was enhanced up to 30% in this case. At the moment, it is impossible to say whether or not external incense rubbing is similarly effective in this regard due to a lack of evidence. Animal studies, on the other hand, have revealed that frankincense cream has a demonstrably favorable effect. Bronchial asthma is characterized by inflamed patches in the lungs. The inflammatory and chronic propensity is one of the causes of asthma. When compared to immune-suppressing corticosteroids, boswellic acid is likely to have less negative effects. It was discovered that taking 300 mg of frankincense extract for 6 weeks improved symptoms in 70% of individuals. Shortness of breath, seizure frequency, and breath noises were among the symptoms. In comparison, just 27% of patients in the placebo group improved. The treatment was evaluated with frankincense, a 500 mg extract of boswellic acid, as well as in combination therapy with traditional medications. Following that is a list of typical areas of application that, from a scientific standpoint, have not been sufficiently examined. Frankincense is a classic all-purpose weapon. Because there were no medicines or disinfectants available in the past, people relied on natural ingredients to treat a variety of inflammatory and infectious illnesses. Frankincense is an excellent choice for this purpose because it may be used both internally and externally. The expert on inflamed skin historically, frankincense has been used to treat infections and irritated skin. Antibiotic components have been detected in laboratory tests. Ayurvedic medicine uses Indian frankincense to treat skin disorders. It is used to treat abscesses and skin irritation, such as psoriasis, by placing a patch externally or with a suitable ointment. As an antiseptic astringent, frankincense is used to dry and sterilize the skin of ulcers. Frankincense is even considered to be suitable as a cosmetic, calming the skin while also fighting wrinkles. However, legitimate scientific tests are now unavailable. The mucous membrane is cleansed and preserved with frankincense. Frankincense has an effect on the mucous membrane as well. The resin is eaten for this reason, which softens and flows it. Frankincense is used to treat hoarseness, catarrh, and irritation of the throat-mouth mucosa in Europe. When one has a cough, it encourages mucus expectoration. Even if you have thrush, the resin should assist because bacteria in bad breath can battle it. Chewing frankincense is also claimed to be beneficial to teeth since the resin is said to come to grips with plaque while also relieving gum inflammation. Frankincense also affects the stomach and intestines. In India and Africa, particularly in ancient societies, gum resin is used to treat internal maladies such as diarrhea, indigestion, and stomach disorders, as well as urinary tract problems. According to what is known about it, frankincense can also be highly effective in this area. The required active components are reached in sufficient quantities in the stomach and intestines, but whether they reach the blood and urine in comparable proportions is dubious. Currently, some formulations are being developed to enable greater and more efficient absorption of the boswellic acid. Frankincense is also said to be beneficial to the intellect. This is where Persian medical science comes into play, as it suggests consuming frankincense resin beads to strengthen the spirit and mind. In India, frankincense is used to treat forgetfulness. Aromatic frankincense is frequently utilized in Christian religious events. The question is if the application is owing to its soothing impact. Aromatherapy, on the other hand, uses the essential oil derived from the resin to treat stress and anxiety. There have been no human investigations or research on this subject, although cell cultures stimulated with frankincense have exhibited nerve growth, both in terms of growth and branching of neuronal processes. Even learning performance was boosted in animal trials. The question now is if frankincense can help with neurodegenerative disorders. This would still need to be investigated. Now, frankincense has made its way into modern medicine. Experiments are being carried out to investigate the effect of frankincense on prostate cancer, nerve tumors, and blood cancer. Cell cultures show decreased growth as well as increased cell mortality in prostate cancer, leukemia, and meningioma cells. However, no data exist to support its use in affected persons. The key issue is that no detectable amounts of the appropriate active compounds were found in the test subjects. The regulatory authorities recalled the product, which was to be used to treat cerebral swelling caused by brain tumors. Nonetheless, study on the subject is still being conducted. In theory, boswellic acids would be ideal because they can pass the blood-brain barrier. The University of Freiburg's Department of Radiation Oncology reported a pilot study that showed a reduction in cerebral edema after radiotherapy. This is exactly what gives hope for future research. What kind of frankincense are available? Because of the quality of the resin in question, the prices of incense preparations on the market vary quite a little. The evaluation criteria are based on the content of essential oils, which are responsible for the characteristic smell of frankincense, although the time of harvest also plays a significant impact. The quality actually improves with each harvest, despite the fact that the initial crop was always thrown in the past. However, as demand grows, it is increasingly exported. It should be noted that the plant's smell varies from year to year and is affected by the climate. The purity, color, and size of the resin chunks all play a role. Simultaneously, the purer the resin, the greater the price. The resin is hand-cleaned to remove any dirt or wood splinters. The price is also affected by the size of the resin parts. Larger bits of resin have a better quality rating. The hue of the frankincense tree can range from very black to greenish, grayish, white, brownish, and golden depending on its location. What kinds of frankincense are there? As previously stated, frankincense can be used both internally and topically, therefore there is a differentiation to be established. For external use only. On the one hand, there is frankincense lotion for extremely dry skin. It can be used in conjunction with therapy for psoriasis and neurodermatitis. There is also frankincense cream, which can be used on a daily basis to treat damaged or inflamed skin. However, the gel has a stronger effect on dry skin and can also be used for joint massages after sports. Dry extract is blended with oils and powders and plasters in Indian Ayurveda. Frankincense pills for internal use. For internal use, frankincense capsules, H15, are primarily used as a dietary supplement. Because the capsules are free of animal gelatin, they are also suitable for vegans. Hemorrhoids, chronic digestive disorders, and rheumatism may benefit from frankincense capsules. How many frankincense capsules can I take per day? This is determined by the real goal of ingestion, as well as personal and health circumstances. The daily frankincense dosage is calculated individually based on the expertise of the particular therapist or doctor. However, pharmacists can also assist in this regard due to their experience. Basically, and unless otherwise directed, the following is advised. Take 1 to 2 frankincense capsules with a glass of water 2 to 3 times a day, just before eating. So that the capsules can later mix with the food pulp. As a result, the meal fat can better break down the fat-soluble active substances, improving absorption. In the description, we linked products that will help you. We hope you will give us a thumbs up and share this video with your friends. We look forward to see you in the next video.